A very good morning. The title of my presentation today is How do academicians cope with occupational stressors to alleviate burnout? The experience of research universities. I would like to acknowledge all the co-authors of this paper. Burnout in tertiary education sector is a public health concern. A multi-sectorial comparison studies has revealed that education sector is among the highest rated in terms of burnout and also occupational stress prevalence. A local evidence also echoed this magnitude of burnouts among academicians, with recent studies show that local research university academicians were having higher levels of burnout compared to the other local private universities in Malaysia. And local systematic review published in 2017 has revealed the main stressors were the research, career development, teaching, and also interpersonal conflicts. Therefore, this scarcity of research, which actually limit our scientific evidence to justify appropriate intervention, should be stated here to combat burnout among university academicians. The biggest gap, based on the systematic review, is to understand the effect of coping strategies as the mediators for work stresses and burnout. So this is the objective of this study, to determine how academicians cope with academia's work stresses to overcome burnout, specifically to estimate the effect of academic work stresses such as research, career development, teaching, and also interpersonal conflicts towards burnout. And secondly, we want to examine the effect of coping strategies as the mediator towards work stressor and burnout relationship based on the research framework adopting by the transactional models of stress and coping by Lazarus and Folkman. So this is a cross-sectional study which has been done in 2017 involving 327 research university academicians in Klang Valley, with a list of all these academicians from 12 faculties was sampled using the multi-stage sampling methods. And the study instrument which have been embarked in the study is the SSQ for the stressor for research, teaching, career development, and interpersonal conflict. The brief scope for these 14 types of coping strategies, and also the mass/inventory educators survey for the burnout scale. The data collection method was done via the computer-assisted self-interviewing, and also the analysis was done via the SPSS and also the SPSS AMOS for the covariant-based structural equation modeling analysis. So the response rates for this study is 85.5%, with the age of this respondent range from 28 to 65, and also the majority of the respondents were female, Malay, and married. So this is the result for the model assessment. The measurement models has revealed a good internal consistency, reliability, convergent validity, and also discriminant validity. And the structural model assessment also revealed all fit indices has been above the recommended value, and also the final model, especially to determine the explanatory power for the dependent variable, which is the burnout, has revealed a good R-squared prediction based on these illustrated results. So the model assessment for burnout among the academicians in Malaysia has revealed that 3 antecedent or predictors has been significantly related towards the burnout progression, which is the research, career development, and also the interpersonal conflict. And as illustrated in these models, the mediation effect of coping, which is via the adaptive coping and also maladaptive coping, has also predominantly played a role in alleviating the burnout, whereby the maladaptive coping showed to be more prevalence with the higher effect size of 0.37 in comparison to the adaptive coping. There are some stressors which are not being mediated by the coping strategies, such as the career development, whereby it has some direct effects towards the burnout progression in comparison with research and also conflicts, interpersonal conflicts, which has actually been mediated by the adaptive and also maladaptive coping. So adaptive coping and maladaptive coping have alleviated burnout based on the structural model being presented earlier, but it not actually adequately suppress it, as there is some evidence also the certain stressors such as career development which has direct effect towards the burnout. So academics were actually struggling or rather unable to cope with the academia work stressor via the adaptive coping strategies, and left alone have to choose for maladaptive coping strategies. Maladaptive coping strategies, in the other hand, still have the impact in alleviating the burnout progression, but this trend is unsustainable if the exposure of the high intensity and also chronic stresses continues. This will subsequently lead to the diminishing of the coping resources and end up accelerating their burnout progression. So some of the recommendations are based on the integrated approach models, which actually focus towards the organization approach plus the individual level approach. So engagement of academics with the university's authorities to re-evaluate the aims, objective, standard, and also KPI are much needed. For example, in the research components KPI. Improving the interpersonal relationship among academic co-workers, supervisors, and also administrative staff, with prioritized towards preventing role conflicts, improving communication and leadership, and also revising the detail of job scope and description is much needed. Establishing this screening and surveillance system for burnout and work stress via the yearly anonymous online surveys via email, which has been illustrated by this study, should be one of the measures embarked by the university management, and providing the individual level interventions such as refreshing courses for the skill-based, coping strategy interventions such as cognitive behavioral therapy, and also certain families related program should actually reduce the prevalence of burnouts. So for the conclusion, high stresses due to research, interpersonal conflicts, and also career development are the predictors of burnout among our academicians. Coping strategy alone will not suffice to suppress the burnout progression without the primary work stresses intervention. Therefore, the integrated approach, which has been mentioned earlier, are crucial to prevent the burnout among academicians. The research model offers new prospects to supplement the previous body of knowledge in addressing the complexity of causal relationship of burnout. And it has been illustrated by the structural model of this study. Therefore, I thank you.